So my session now is on Project Charter. So in your packs you'll have a blank example of one of these. Who, out of interest, who for your project, who already has a charter? Yes, I think it's probably people who've been perhaps involved with the Quality Improvement Facilitator course. Your project will be advantaged by those people who've been involved in this training, because they will have been probably getting those documents already worked out, because they will have had to have them to do the course. So we'll go through the aspects of what an charter is. Also at the back, just so that you know, there is this resource that we have available for you. And it's just a little pocket guide of the model for improvement. Those who've been at our co-design workshops may already have one. But just for those who haven't, it's just a really handy little guide for you to say, it's just got the model for improvement, the 3 questions on it. It's got the ones about what are you trying to accomplish, about how will you know, and what change can you make that will result in improvement, and then the plan, do, study, act cycle on the back. So that they're just on the table at the back, or else I have got some here I'll just put at the front. So this session is also meant to give you a little bit of time to spend at your tables in your group. So I'll just give you a pretty quick overview and then allow you some time to work together. So I think I've already explained what I missed before about where we're at in our quality improvement or cycle. So this is called Connecting Care Collaborative, and what that means, it's basically a quality improvement collaborative. And what we've done with our work that we're doing more and more, I think in New Zealand, I'm not sure how many other places are doing it at the moment, that we actually front foot this whole quality improvement cycle with our co-design phase. So we're actually hearing what are people saying about what is the problem from their perspective, what does good look like, so that that consumer voice is woven through our work, rather than, as Roz or Kevin mentioned before, that people are consulted and then we go away and we do what they said, but actually we never involve the people again in terms of the one who said this is how we'd like things to be. So we're at the moment still, I think some of our projects are at very different phases. Some of you are still trying to understand your problem, and that's a really important phase to go through. And I think Kevin made mention of that how important it is to go through those steps so that you have a clear definition of your problem that you can communicate to other people on the team, other people who you want to engage to be part of your work. Because unless we are really clear about what the problem is, you'll find it really difficult to describe what you're trying to do to anybody else. And so there's some people who are then at the setting the aim phase, and then there are others who are involved, who are actually now ready to start testing changes. And that doesn't mean that anybody's right or wrong or behind or in front. It just means that that's where you're at in the process, but how important it is to actually follow the steps, because it can get a bit frustrating. You think we're just going round and round and round. How many more months can we spend trying to define the problem? But I think I can see Sherida nodding from experience that sometimes that can be a frustrating phase, but it's actually really important to still follow that all the way through. So in terms of the project charter, so I think in your packs you've got, this is one of many. This is actually one that we've used that was from Koawatea. So there's no absolute, you must use this template for your project charter. It's one, so there are many templates about, but this is just one we've given you that we're sharing today. If you find a better one that works better for you, feel free to use it. But we have also seen project charters that are 26 pages long, and we didn't think you'd want that one. So we chose one that was doable, workable, easy to give to people as an explanation about what your project's about. So there are some key steps in your project charter. So, but basically what we're saying so that's what I've been talking about using the process, that all improvement happens project by project or process by process, and actually there's no other way, there's no magic bullet. And so the aim of the project charter is to address those three key model for improvement questions, which are, what are we trying to accomplish? How will we know that a change is an improvement? And what change can we make that will result from improvement? And I was just listening recently to the Don Berwick and Maureen Bisignano, who are key people at the Institute for Healthcare Improvement in America, and they were doing a session at I've forgotten the name of the big conference, Quality Improvement Conference, that was held in Glasgow just a couple of weeks ago. And they actually said that the most important word that they think in the model for improvement is we. So what are we trying to accomplish? So not me or one person, but what are we as this project team trying to accomplish? How will we know that a change is an improvement, and what changes can we make that will result in an improvement? So what you're going to do through your project charter is you're going to have basically a charter is just, again, this is sort of maybe quality improvement terminology. You could call it a plan, or it's just that's the word that is used. So basically it is to describe your project in a brief way. What are you trying to accomplish? What is your scope? Because that's really important as well, because there's this whole thing about scope creep. And who are you going to need as part of your project team? And the point about the scope as well is to clarify what's not going to be addressed. So you can be very specific about defining your aim of your project and your scope, and then you can be very clear about this is not what this project is about. And the point of a charter, the driver diagram, any of these tools that we'll talk to you about today is that they are a living document. So you might be up to version, I don't know, I think we're up to version 7 at the moment. I was just working on yesterday for a plan that I've written for a project. Nothing's ever set in stone, and even actually the project overview that's part of your, this also, the piece of paper that you have in your packs that's just the overview of our timeline, which informs our project charter as well. I changed that yesterday. So it's just to make the point that this is a living document, and so all our documents are growing and it being iterated as we learn things from the zero seclusion work, who are sort of 6 months ahead in their whole quality improvement phase. So in terms of stepping you through then the charter, so what the components, so the main components are, so this is on your piece of paper here, project background. So basically that's your project statement. What are you, why are we doing this? So what is the background to this project? Why do we need to do this piece of work? Is there evidence that we can use to describe the problem? Where is it happening? Is it in a particular unit, a particular group of people? Like for one of our transitions is youth to adult, so that would be where our issue is focused. What are the opportunities? Who's impacted by it? And what are our expectations? So yes, state the customer, so that's customer or consumer expectations. So what are we aiming for? And then our aim statement. So I'll go into a little bit more detail about how you might word your aim statement. So basically the aim statement is who are the main beneficiaries and what will they gain, the time frame, and what is your goal. So basically how much and by when. So for those on the Quality Improvement Facilitator course, this will be very familiar to you. And again, I think we've talked about scope. So be really clear about the scope of your project, because you might have already experienced this already as well. As soon as people start hearing that you're working on a particular piece of work, they'll come and say to you, oh, what about this and what about that? And there's a problem here and a problem there. But you need to be able to define your scope and keep to it as well. Otherwise, you'll be, before you know it, working on a massive project that is just not manageable. So what are we trying to achieve? What are the goals? And I think we've talked about this. Who's going to be affected? Where are we? Where is the focus or the target of our piece of work? And this is the important bit as well, the measures. So Natalie will talk more about the measures later. And I think Kevin mentioned as well about having the importance of having baseline data. So because if you don't get your baseline data, how will you know that any change has been made? So even if you haven't got your baseline data at the moment, maybe speak to your data people at work, or that might be, it doesn't have to always be quantitative data, it could be qualitative baseline data, but just so that you have at least some data that tells you what is the current situation. And then you think about your changes, so what changes are you going to make that it will lead to improvement, and then really importantly, who are you going to have on your team? So I think we've heard today, and I think we will continue, I suppose, to say the importance of that. Not only do you have the project lead, your clinical champions, your clinical lead, and the key person involved in your organisation is your sponsor, and we're learning more and more how important the role of sponsor is in the team, because that's the person that will help you, or their role is to help you when you come up against roadblocks. Do they need to help you manage up to the senior executive level? But also we hear how important it is to have consumer, family and whānau involvement in our project teams, as long as also Maori health representative in whatever way that comes in the project. Some DHBs we know struggle to have that resource, like we just visited the West Coast DHB last week, so the smaller DHBs sometimes struggle with have one person who covers that role for the whole physical health and mental health services. So yes, but how important it is to engage those people in the project work. So this is about working on your problem statement. So that could be your also called your aim statement. So it's basically a well-written one. It's about when I'll just go through some examples. When are we seeing this problem? How big is it? What is the problem? What did we fail to meet? Is there evidence that quantifies the problem? And also it's very easy to skip to solutions, to think that you already know the reason for this problem and to write that into your aim statement, or in things in wording around, you might have wording around, what's an example I can give of that? That you know that there are problems with transition plans not being handed out because the GP's office is or the GPs aren't available when you need them. I'm just making up a reason, but it's very easy to write that into your aim statement. But actually, if you knew the reason, you wouldn't be needing to make the statement because you would have already solved it. And this is the thing about aims as well. Maybe they are impossible, because I think also Kevin mentioned that if we carry on doing what we've always done, we'll carry on getting what we've got. So actually, the thing about setting an aim is it should feel not unreachable, but almost unreachable, but almost unreachable. So that actually you are, because you're going to be doing something different. So that they should be ambitious, but you should also be able to measure them. And they should have a time frame, because there will always be other demands on us. So with these pieces of work, we can't be working on this for years and years and years and years to come. So actually we have an aim, we set an ambitious aim, like the Zero Seclusion Project, seclusion free by 2020, December 2020. So that's a big aim that project have set. And the important thing as well that we see sometimes, because Karen and I, O'Keefe is involved with this our overall program work, and we've been on a number of DHB visits together. Karen's based in Northland. So what we've seen sometimes when we go and speak to the projects is that the connection between what you've got on your aim and how you're connecting that to your plan that sometimes doesn't connect. So for example, with some of the change ideas that's great that people are at the stage to be testing those, but how are you linking those change ideas into your driver diagram, which Andrew will talk more about later if that terminology is not familiar with to you, how are you linking that into your driver diagram with your drivers leading to your aim? Because if your aim is to improve transition plans for etc., and then you've got a change idea that's actually nothing to do with that aim, you're really in a way wasting time, because then that aim, that change idea is not linking into anything, or is not going to impact your aim. So it's been quite disciplined to think, actually, this change idea, how does that link into what we wanted to achieve? Because again, everybody has scarce resources, so we want to make the most of everybody's time and availability. So I think I've been said that about how much, how good, for whom, and by when. And so this is the thing about also aims being SMART. I think that's quite a well-known terminology, that they need to be specific, measurable, attainable, relevant, and time-based. So these are just some examples of aim statements, and then we can just hear what people think about those. So we aim to reduce harm and improve patient safety for all of our internal and external customers. So what do people think about that aim statement? Yeah. Yeah. Do you think and I wonder how they're going to measure that. And then, yeah, so that could be until 2025. We don't know from that one. These are all, these aren't just made up ones. These are ones that we've come across, well, in various pieces of work. What about this one? Yeah. And who's the we? Is that inpatient hospital staff? Is that outpatient clinics? Where is that? So they're missing the specific. They're missing really they've got a little bit of the measurable. We don't know if that's attainable. I presume it's relevant. We all know how important hand hygiene is, but it's got no time frame. Yeah, so again, we don't know who's involved, what target people are trying to meet. And this is an example that I've taken from one of the QIF storyboards. What do people think about that one? Yeah. That's a pretty good aim. They've got the time. It's very specific. You can see the scope of that work in that aim statement. Attainable. They've set a goal that they want to attain. Very relevant to their piece of work, and it's got a time frame.
And the time frame is relevant to people that transition plan is made for. It's not set for yearly in July.
Yes.
Or it's meant for these people by the time they reach a certain age. Yeah. Time is useful to people.
If you wanted to be very pedantic, but I think that's a very good aim, because, as I say, if you just read that, if you don't know anything about that piece of work, you could read that aim statement and know what that project is trying to do. The one thing that, if you're being very pedantic, you could say is from what to what, because we don't know what it is at the moment. So 90% of CAM's consumers. So if, as I say, the one little extra bit, that if you've got your baseline data, you would know. So maybe it's 60% at the moment, from 60 to 90 by the how much by when. But overall, that's a really good example of an aim statement. So maybe we'll take this opportunity now while you're here in your project teams, for those who haven't got your charter, because also having a charter is a really useful document. I actually don't know how many times I've sent the one around our Connecting Care one out quite a lot now to people. Like, if management ask you what's your project doing, if you get asked by other people, you can just give them your charter. So maybe I would say now if we spend the next, up until lunch, just having that time at your tables, thinking about, if you haven't done it, defining your problem. What is your aim statement? I know there are some of you who are still thinking about scope. What are some measures? And then we'll talk more about driver diagram afterwards.